Hearing loss is a common problem affecting about 1/3 of older Americans. It can be caused by age, noise, disease, or even inherited. But one thing's for sure, if you just ignore it, it probably will get worse. Each May, the American Speech Language Hearing Association recognizes Better Hearing and Speech Month to raise awareness about the importance of communication. Seeing a hearing specialist can go a long way in protecting your ability to hear. Audiologist Paige Holt, with the hearing aid and audiology specialists at Lake, Ear, Nose, Throat, and Facial Plastic Surgery, talked to us about some of the early warning signs of hearing loss, its causes, and why it's important to get a baseline hearing test.
There are many different things that can cause hearing loss. The most common would be aging and just degeneration of the hearing nerve. Noise exposure. Men who work in a factory around loud equipment, women can work around loud equipment as well, but we also can see some ototoxicity with certain medications that you take and certain drugs that are taken. Some of them are needed for life-threatening situations, and in those cases the physician who is administering that medication will refer the patient for monitoring to monitor the hearing over time as they take that medication to make sure that they're not losing a lot of the hearing. Hearing loss can be genetically related, and so we always would recommend that if you do have a strong history of hearing loss in your family members, that you do start having your hearing screened in your middle years, because we want to know what your hearing is, a baseline, so that if you do have something happen and you start feeling like you're not hearing very well, my ear feels plugged up, I have some fullness in my ear, I have some ringing in my ear, then we can have a hearing test performed and we will have a baseline to compare it to so that we can determine, is your hearing starting to progress? Is this just an episode that we can treat medically and have it recover? Or are we starting to see some aging? Some of the first symptoms of hearing loss would be ringing in the ears. Ringing in the ears, what we call tinnitus, is something that is a symptom of damage to the hearing nerve. So many people will come in and say, my ears are ringing, and one of the first things we will do is test the hearing, because we want to determine, is there some damage or degeneration of the hearing nerve that can be associated with that ringing. Occasionally we will see someone who has a sudden hearing loss, and there are some ways of treating sudden hearing losses that we might see some recovery. But in general, when you start to see the gradual progression from the aging process, it's not something that we can recover. As aging occurs, there's damage to the hearing nerve. There's no way to stop it from happening. You'll just continue to have a progressive hearing loss over time. The hearing aids will help you hear better. They will not cause further hearing loss, and they will not really prevent further hearing loss. One of the first things that we start to see are family members, significant others will start to notice that you're missing out on conversation. And they will usually begin to suggest that. And sometimes that's taken very easily, sometimes it's not. So it's a little bit of a touchy subject, but we do recommend that people come in just to have a screening. And we will be honest and let you know if you're in the area where we need to start considering amplification or not.
For more information on the hearing aid and audiology services available at Lake, Ear, Nose, Throat, and Facial Plastic Surgery, please click the Hearing Better story link on our homepage at yourhometownhealth.com.